All right, guys, we're now going to look at the care of the patient with hematological problems. And here we see our objectives, our principles of infection control to prevent infection and injury when caring for a patient with these hematological problems, um, who usually do also have reduced immunity. We want to teach both the patient with the hematological problem and the family how to avoid injury and complications at home. Physiological integrity, we want to assess and reassess the manifestations of the patient being managed for the hematological problem. We want to use appropriate strategies to relieve pain and promote comfort for these patients. And we also want to use laboratory data and clinical manifestations to prioritize nursing care for these patients during both acute or chronic hematological problems. I mean, if you're going to murder a word, you might as well just keep saying it over and over, right? All right, moving on to our first one here. We're going to start with sickle cell disease. When you look at sickle cell disease, know that it is a genetic disorder with an autosomal recessive pattern. It is an abnormal hemoglobin chain that distorts the RBCs into a sickle shape. When you look in the book, you'll see the pictures of the sickled red blood cells. And if you see these sickled red blood cells, they become sticky and fragile and they all clump together. There's excellent pictures of that in your book. And this causes a blocked blood flow. And with that causes hypoxia, resulting in more clumping. Conditions that will cause the RBC to sickle. Now, this is only in a patient who has sickle cell anemia, okay? Patients who have sickle cell anemia go through periods of extensive cellular sickling called crises, and these can happen very suddenly. Vascular occlusive events lead to more hypoxia and more ischemia and more tissue damage. Usually the sickle cells go back to normal shape, but the thing, even though they go back to their normal shape, the hemoglobin remains twisted when the precipitating factor, even after the precipitating factor is removed. And oxygen is back to within normal limits, allowing for normal tissue perfusion. But keep in mind that the hemoglobin is still twisted even if when the red blood cells go back to the regular shape. So some of the conditions that cause red blood cells in the sickle cell patient to do the sickling is periods of hypoxia, dehydration, infection, venous stasis, pregnancy. A lot of women will have sickle cell crisis during their pregnancy. If they are in high altitudes, extremes in environment or in body temperatures, stress, anesthesia can cause a sickle cell crisis. And if the patient has acidosis, or especially respiratory acidosis, will cause the sickle cell crisis as well. So more sickle cell facts. With repeated periods of the VOE and impaired perfusion, you have long-term damage. What this results in is chronic anemia. These patients a lot of times have chronic pain. They become disabled. They'll have organ damage from the sickling of the red blood cells. They have an increased risk of infection. And a lot of times they will have an early death due to poor blood perfusion. So who is the sickle cell patient? It's in the U.S. It's most common in your African American populace. It may not, they may not even know that they have inherited the trait until they're in crisis. Now, that is what our book says, and that is the way I would test it, because it says they may not know until they are in crisis. But most states, well, okay, I can't say most states. I know this state, which is North Carolina, and South Carolina as well, in their newborn screenings, look for the sickle cell trait. That's all I know because that's what I do on the weekends. I work with babies, and that is one of I believe there's 80 some odd things that we look for right now in the newborn screening. It was 68, they upped it at some point. But anyway, that is one of the things that they do look for at present time in North and South Carolina. And I wouldn't test you on that because that's just random knowledge out of my head. But do know that sometimes patients are not aware that they have the sickle cell trait until they are in crisis. Pain is the most common symptom of a sickle cell crisis and is a nursing priority. It is a painful, life-limiting disorder. And I want to make sure you review the signs and symptoms of a sickle cell crisis on page 810. Now, sometimes patients who are in sickle cell crisis would be in a critical care unit, but sometimes they're not. So it is important for us to look at what we do for this patient when they are in crisis. We're going to need to administer oxygen. We're going to make sure that we're giving them their prescribed pain medications. We're going to make sure that we are hydrating them. We're going to remove any restrictive clothing. We're going to raise the bed to a knee position. We're going to encourage the patient to keep extremities extended to promote venous return. We're going to keep the room nice and warm. We're going to avoid taking blood pressures with an external cuff because a lot of times that squeezing is so painful. We're going to check circulation in the extremities every hour. You want to do the pulse ox not only on the fingers, but also on the toes to make sure we're not having any clotting. We're going to make sure that we're checking our peripheral pulses, and you want to make sure that the toes don't become like an icy cold, and that they just stay the normal temperature of where they have been. Okay, but main things to know is that pain is the most common symptom and is the priority. That we check these patients frequently, that we're checking pulse oxes, we're checking temperatures, and we're trying to keep these patients comfortable, and that it is an autorecessive disorder. So we've already talked about taking care of the patient when they're in crisis. You want to prevent sepsis because they are at a greater risk of bacterial infections due to damage to the spleen. So your patient with sickle cell crisis is at a greater risk for bacterial infections due to the damage to the spleen. So you want to prevent infections and or early detection of infection. So you want to make sure that the patient is taking their temperature and that they are aware of the signs and symptoms of infection. So what education do we want to give these patients who have sickle cell disease? Well, remember that we collaborate in our care of these patients with the patients and also with community resources as well to help this patient have the best outcomes that they can. The patient and families are partners in this lifelong treatment of sickle cell, and it's critical for improved outcomes. Both the economic level and education level have a positive correlation. So the more influential they are and the more educated, the more positive correlation these patients have with their ability to successfully perform self-care. Okay. You want to make sure that you teach the patients to avoid specific activities that reduce gas exchange from like hypoxia, and to be able to recognize early symptoms of both stress, both crisis and of infection. All right. You want to teach the patient and the family the correct use of the opioid analgesics at home. Sometimes these patients do have some of the sickle cell patients will have some drug seeking problems. The other thing is to make sure that they have genetic counseling prior to choosing to be pregnant to see if they are a carrier. I have a dear friend who is a carrier, and her and her now husband, they both, he had genetic testing done to see if he was a carrier because that would have put them at risk of having a child with sickle cell. And this type of testing was not available when her parents were married, and her brother has sickle cell anemia. I mean, he does well. He's but again, that's where you see that positive correlation. Of course, this is only one person with education level. He was, they were middle class family. He's well educated. I don't really know what he does for a living, but anyway, I know he went to school. But anyway, point being, he has the education and the means to have good self-care, and that is what he has. He's been able to successfully take care of himself, but he has had issues with sickle cell crisis several times when he was in college. I know that was an issue, and then he's had some as he's gotten older as well. It tends to be, again, during periods of stress. And he did have a very bad sickle cell crisis with anesthesia. And really that just goes along with that periods of stress. So you want to make sure that the patients take time to learn how to prevent these sickle cell crises. And that's on chart 40-2. Okay. And that's prevention of sickle cell crisis. It talks about drinking plenty of water, avoiding alcohol. Again, we don't smoke. Nobody smokes. We make sure we get our flu shot because we're immunocompromised. We always consider genetic counseling, avoid strenuous activities, make sure that you are doing some kind of low or mild impact exercise 3 times a week when you're not in crisis. But these education tips are good. Also, to avoid traveling to cities of high altitude such as Denver or Santa Fe. Alrighty. So make sure you do look at that chart 40-2.